But we start with the pandemic, which shows no signs of slowing down, with records yesterday in number of daily cases, number of daily deaths, and number of hospitalizations. The U.S. recorded nearly 205,000 new cases reported in a single day yesterday, according to an NBC News tally. That figure comes just a month after the U.S. single-day record topped 100,000 cases for the first time. And according to the data, yesterday alone, more than 2,700 people died from the virus, making it the deadliest day for Americans since the start of the outbreak. We're not getting better, it's getting worse. And hospitalizations also reached an all-time high. The U.S. is reporting more than 100,000 people are currently in hospitals, sick with the coronavirus nationwide. According to the COVID Tracking Project, this more than doubles the number of hospitalizations compared to the beginning of November. Many hospitals are running out of beds or turning away new patients, limiting the care available to both COVID patients and those with other health care emergencies. Willie.
So there are the numbers, and here are the warnings. The latest White House Coronavirus Task Force report warns state officials of a historic high risk of the virus. NBC News obtained a copy of the report issued to state governments, which reads in part, "The COVID risk to all Americans is at a historic high. We're in a very dangerous place due to the current extremely high COVID baseline and limited hospital capacity. A further post-Thanksgiving surge will compromise COVID patient care as well as medical care overall." The memo continues, "If state and local policies do not reflect the seriousness of the current situation, all public health officials must alert the state population directly," Joe. So what the task force is saying there, it's pretty staggering, is if your governors, if your officials are not taking this seriously, public health officials, go around them, go right to the people and tell them what they need to do.
Well, and really, we've got to break this out into two parts. We can talk about some Republican governors who were still being extraordinarily reckless, who were still ignoring science, and still ignoring basic medical guidance and advice. And then we can talk about the other governors, many of them Democratic, or some of them Democratic, and the mayors who are saying one thing publicly, but acting recklessly privately, and undermining everything that they seem to be suggesting. We showed a shot of Gavin Newsom a couple of weeks ago, having that dinner at beyond a one percenters restaurant, jammed in there. But you have the mayor of Austin in Cabo, while he's telling everybody to stay at home. You have, what was it, the mayor of Denver telling everybody to stay home, and then he leaves.
Yeah.
I mean, and you go down the list. These people who, even some of the leaders who are who sound like they're saying the right thing, are being raging hypocrites, and people can't hear what they're saying because they see what they're doing.
Yeah, I mean, we've had a couple of those. The mayor of San Francisco now, we know, the mayor of San Jose, again, going to restaurants, holding gatherings over the Thanksgiving holiday, all the while standing in front of the people and telling them to do just the opposite. The hypocrisy is pretty stunning. Meanwhile, the director of the CDC, Dr. Robert Redfield, yesterday had a stark warning himself about the pandemic for the coming winter months.
The reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation. We're in that range potentially now of starting to see 1,500 to 2,000 to 2,500 deaths a day from this virus. So, yeah, the mortality concerns are real. And I do think, unfortunately, before we see February, we could be close to 450,000 Americans have died from this virus.
Yeah.
Yeah.
Go
ahead, Joe.
Go ahead, Willie.
Well, I was just going to say the director of the CDC there now, he sees it necessary to go out publicly and raise the stakes because he's not seeing mitigation efforts being taken seriously. He's watching what's happening in the hospitals. One of the phenomena that he talked about and that's going on here, Joe, is that these rural hospitals and hospitals across the country who previously could offer nurses and doctors to go to big cities to help with these outbreaks, they can't afford to give up doctors. They can't afford to give up nurses because it's happening in their states now, too. It's critical almost everywhere.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.